India Ahead. Hello and welcome. You're watching India Ahead with me, Neha Khanna. Our big focus at this hour, we often hear about long COVID or the post-COVID syndrome, the after effects of COVID that many of us are suffering from even long after recovering from the infection. Now the World Health Organization has expressed grave concern over it. Talking about it, WHO's Maria Van Kerkhove has said, long COVID is real. It is something the WHO is deeply concerned about. We don't know how long these effects last. We are working on a case definition to better understand and describe what this post-COVID syndrome is. We advise anyone who's suffering from the long-term effects to seek help. Now, there are over 200 symptoms of long COVID that have been reported around the world, including in India. These include shortness of breath, extreme fatigue, brain fog, cardiac and neurological disorders, chest pain, tingling, rashes, pain in the nerves and muscles, high blood pressure, sudden onset of diabetes, migraines, intestinal ailments, skin problems, sleep disorders, mental health conditions such as anxiety and depression. The list goes on. So we're asking, how widely prevalent is long COVID? How concerned should we be? How long does it really last? What should we do to deal with it? As the WHO advises, is it time for many of us to seek medical help? Let's put those questions to our guest. Joining me on the show tonight, Dr. Dheeraj Kaur, physician nephrologist, clinical researcher, and data mining focus on COVID-19 and medical journalist in the United States, Dr. Praveen Chandra, chairman of the Interventional Cardiology Department at Medanta Hospital, and Dr. Mohsen Wali, senior consultant for Gangaram Hospital. Dr. Kaur, let me begin with you. Now, as someone who got COVID 4 months ago, I can vouch for how real long COVID really is. It's been over 4 months and I cannot understand for the life of me why I feel so tired and fatigued all the time. And I really mean all the time. But there are people who have suffered worse, far worse post-COVID effects. I just listed some of those. The question really is, now that even the World Health Organization says that this is something to be really concerned about, what is your take? How rampant is it? What percentage of those people around the globe who've had the COVID infection do you think are now suffering from this post-COVID syndrome or long COVID? And how bad do you really think it is? Because nobody seems to have a grip on how long this even lasts.
Thank you so much for conducting such an important discussion on a show. We have spoken about it on different media channels last year, even towards the end, and this year. And you're absolutely right. You're not alone in the boat. Believe it or not, even after getting vaccinated, I got COVID. And I had intense fatigue for 3 months, which was very unusual, some joint pains, and luckily I've recovered. But not everybody is that fortunate enough. But you're absolutely right. This is a concern which, because of the heat of the COVID, there are so many things at hand. We kind of lost focus on this small issue, which is really not that small, because millions of people who are passing through the COVID across the globe will have residual symptoms. And I will share some data with you. For example, British Health Institution had an article published which showed clearly that 10 to 20% of patients have symptoms more than 1 month after the diagnosis. And there was a study which was coming from Italy which showed around that number can be as high as 65%, 60 days after you are diagnosed with COVID. Now, what is late COVID? Before we go there, we have to understand there are 3 stages of COVID recovery. One is acute stage, which is 4 weeks after diagnosis. Then there is an ongoing stage which can go all the way up to 12 weeks, 4 to 12 weeks. And long COVID generally we address for people who have recovered. It's around 12 weeks after the diagnosis if you still have residual symptoms. Now, what is the most common symptom? The most common symptom of COVID, long COVID, is fatigue, like you said. In an Ireland study, it was showing up to 50% of people had this symptom after they recovered 12 weeks after the initial diagnosis. And the severity of that was unrelated to the severity of COVID. That is a very important information, because people, as you know, if you are vaccinated, you still can get infected with COVID. But your chances of getting severely sick from COVID, hospitalization or death is much, much lower than people who are vaccinated. That formula doesn't exactly go line by line when we talk about post-COVID complications.
Correct.
Including long COVID. Very important. Second was headaches. Third was, like there is a cardiologist sitting here, he will tell you, there was shortness of breath, cough. Around 60% of patients who were discharged from the floors had these symptoms, and residual symptoms were around after 8 weeks who had chest pain, shortness of breath, difficulty, stayed in 70% of the people. A study from China showed approximately 50%. Matter of fact, there was another study which showed that small clots or thrombosis, like microthrombosis, are formed, and even you have a myocarditis-like syndrome, which was seen in 60% of the patients after they recovered 2 to 3 months, which was seen in patients, believe it or not, who were even young, didn't have any comorbid conditions like diabetes, hypertension, and their coronaries were relatively healthy. These are healthy working people.
Exactly.
You have heart attacks, MIs, clots in the heart of a 35, 40-year-old person.
Exactly.
This all happened because COVID is defying all the routine norms which we as physicians are used to.
Exactly.
It is behaving like a total different animal. That's why it's very important to be aware of post-COVID complications. You may have a mild COVID, recovered, and suddenly...
You're quite right there, Dr. Kaul.
Vaccinated, got infected, and then you have complications.
Yes, I don't want to take
very important
specific
to keep
names.
an eye on it.
I'm not a doctor, so I don't want to take specific names of individuals, but there have been cases reported in the media of young, healthy people who got COVID, recovered from it fully, and then months later suddenly died of a heart attack. Now, I don't want to sit here and talk about, how many people this might happen to, but fact of the matter is that long COVID is a reality. Let me go across to Dr. Praveen Chandra at this point. I will come back to you, Dr. Kaul. Of course, Dr. Kaul is absolutely right that even if you've had mild symptoms during your COVID infection, there is no guarantee that you will not suffer from one of these intense post-COVID effects. I would like to believe that I had mild symptoms when I got COVID. Luckily, I'd never had to go to a hospital. But 4 months later, here I am battling extreme and 24/7 fatigue. But, of course, Dr. Chandra, forget about fatigue and brain fog and anxiety. There are people who've suffered far worse consequences. Young, seemingly healthy people, for example, heart attacks, for example, other kinds of cardiac conditions. You're a cardiologist. Tell us what your experience has told you over the last 1.5 years. How rampant and serious is this problem?
Okay. So, as far as the heart is concerned, as far as the blood clots formation is concerned inside the body because of the post-COVID syndrome or long COVID syndrome, to say, these patients actually develop these problems in different mechanisms, different ways. And one of the ways is that the heart becomes inflamed, it's like swollen and becomes weak. And this is part of a very common syndrome which was found in children and adults also, which is known as MISC, which is multiple inflammatory system disorder, where various parts of the body organs, like very important body organs like heart, lungs, kidneys can get affected and inflammation can happen and the body water starts getting accumulated. So this is a common thing which happened, but fortunately we know now the treatment and many of these patients actually recover with the help of steroids and immunoglobulins. And we have seen such patients. Number two is those patients who come to us with clots in different parts of the body, like in the legs, in the brain or in the heart. And then they develop a heart attack or a brain attack or a leg attack. So these patients are also treated, but they have to recognize these patients. So that is why any patient who has a previous COVID and starts developing serious symptoms like chest pain, severe breathlessness, which is not responding to usual care, these patients must go to the emergency or go to see a doctor because then they need urgent help. And that is why it is important to understand that one should not try to just say that it is a long COVID or it is just part of that. We have to identify such people and get them treated as early as possible.
That's exactly what I wanted to come to next. Absolutely. That's what I wanted to come to next. Dr. Wali, not only are some of these post-COVID conditions very worrying, if it's to do with the heart, the lungs, the kidneys, any of your vital organs, what's also scary is that nobody seems to know how long these can last. Some doctors have said 3 months, some say 6 months, some say it could last for 9 months or even longer. Fact of the matter is, nobody knows for sure. Even the World Health Organization says we can't say authoritatively. And what the WHO is also saying is, we now are advising people suffering from post-COVID syndrome to seek medical help. And that is exactly what Dr. Chandra just pointed out. Do you think, some of us have to realize that while people may tell us long COVID is something you just have to learn to live with, if your condition seems like it's serious, well, then don't ignore it. Time for you to see a doctor.
Thank you, Neha. I myself have suffered COVID, as my colleague Dr. Chandra knows about it, and I heard about you. COVID is a poison for the body. It doesn't behave like a standard virus. It involves from the root of the hair till the tip of the toes. Whole body is involved. And it is already very late when WHO is predicting this. We have been seeing post-COVID phenomena for last more than 1.5 years. And Dr. Paul Merrick pointed out first in United States, and he has given the name of long COVID as long haulers. Long haulers are those patients who persist to have symptoms after recovering from COVID. And most important denominator of these symptoms is how severe was the infection in the patient at a given time. Since you are conducting this program, I would say starting from hair fall, deformities of nails, disturbances in the vision, disturbances in temperament, disturbances in the nervous system behavior, like some people have tingling sensation, some people have anesthesia, some people have hyperesthesia, that is increased pain, taste disturbances, smell disturbances, double vision, GIT symptoms like persistent nausea, vomiting, lack of appetite, liver symptoms in the form of lack of appetite plus abnormal liver functions, kidney symptoms in the form of urinary disturbances, recurrent infections, and abnormal renal functions. And apart from heart, it involves the membrane of the heart, which is called pericardium, pericarditis, that sometimes give very confusing changes in the electrocardiogram, as we have in myocardial infarction or heart attack. Then we have in males potency disturbances. Also in youngsters, I am seeing lot of cases of depression, anxiety, anger, lack of sleep, that we call insomnia, and a common symptom like running nose with headache, and stroke-like situation as severe as that in some patients. I have got MRI done, I have got MRI done, and they are showing changes like a minor stroke. So I have followed at least 3,500 cases during the first and second wave. And I was warning, it is printed note in my prescriptions, that please do not ignore COVID. COVID may remain in your body, can produce the symptoms, and this is called
That is very scary what you're saying, Dr. Wali, because you're saying that you actually seen stroke-like conditions in so many patients who may have otherwise fully recovered from COVID. Dr. Kaur, let me come back to you. Since you're in the US, what has America's experience with long COVID been like? What are some of the commonest cases that you have come across? And also, it's a very wide range. As I said at the start of the show, over 200 symptoms related to long COVID have been identified so far in various parts of the world, including here in India. And it's a very wide range. It could be anything from brain fog and fatigue to tingling sensation to something as serious as, cardiac and neurological disorders. Now, a lot of us have been told long COVID is something you need to learn to live with. But at what point do you know that you need to go and see a doctor?
See, it's very, very important question you have touched, and there are many areas of health expertise which are talking about it. I am a geriatrician, pain management, and nephrologist as well. So in kidney, like some of your panelists, doctors rightly pointed out, there are small clots being formed which are affecting different organs. Like you can have it in brain, you have a stroke, you can have it in kidney, we have seen renal failure. Also, inflammation is lasting very long. Now, the problem is this, there were few apps which different companies were working, and still there is going on. which actually will track the data, will have like every day when you are recovered from COVID, you get up in the morning, you fill up for the new symptoms, look at the trajectory of the symptoms from 1 to 10. For example, your headache, is it getting worse? Then associations with it. Is it like a migraine kind of a headache? There are characteristics to it. Is it a tension headache? Or you are having loss of function, like a early stroke kind of thing, or it's totally recovered. So TIA. Same thing with the heart attack. Are you having chest pain? Is it on rest? Is it on exertion? Were you climbing 2 flights and suddenly your ability to climb the flights have gone down? So remote monitoring is the key, because you cannot see these millions of people in the hospital system. So artificial intelligence, machine learning, using our healthcare protocols and algorithms, we have to screen masses and millions of the numbers so that the system can point out who is at a high risk of developing the next comorbid condition or complications from recovering from COVID. You start from neurology, every system can get affected with COVID. Like I said, it doesn't matter how severely sick you were with COVID, that you will have it. Another issue which people are ignoring is psychiatric issues, like one of your panelists just mentioned. Post recovering from COVID, especially people who were in ICU or near death, there is such a thing called post-traumatic stress disorder that is seen. Even people who were mildly sick are having higher incidence of anxiety, depression, and insomnia. Mental health is a big pandemic globally, India, US as well. This has exacerbated that. And people whose organs were weak, like people with mild kidney failure, suddenly after COVID, that has tipped them over. Same thing with the cardiac condition. People with slightly earlier stages of heart failure, they had a MI and now they are tipped over. Same thing with stroke, same thing with liver. Infertility is a common concern arising with it. Arthritis like long-term joint pain and fatigue. That is such a common complaint after recovering from COVID, and you should get attention. And there has to be a machine integrated algorithm, because you cannot have millions of people going to the healthcare system. It will collapse across the globe. So I think there are companies which are working in US, and I'm pretty sure in India also there is very good startup healthcare system. They will have to use technology to screen these people remotely, and then we have to integrate and we have to provide them remote telemedicine care or in-person care, depending on the levels and the degrees of effect this COVID had caused. This is a conversation, trust me, is going to last for years. We have to be ready. There have to be COVID rehab centers. Like in US we are opening, I'm pretty sure in India also there must be opening up COVID rehab centers, where people can go or connect with telemedicine and talk about the concerns they are having. Because you have to live with these concerns, you have to be back to the functional level you were. We need technology to help us with this.
Well, you are quite right, though you're painting a very scary picture, but I understand this is, we have to be realistic about this. You're saying this is
Yes.
a conversation that we're probably going to have for years to come.
Yes.
And you also are quite right in pointing out, you know, that there may be a bit of a question mark over whether a country like India has adequate healthcare infrastructure and enough medical personnel to cater to such a huge number of people who may need post-COVID care in the medium to long term. And according to the WHO, more than 200 million people have been infected with COVID
Absolutely.
around the globe, and God knows how many of them are suffering from long COVID. Even the WHO has no data, no statistics on that. So it's really an unknown sort of entity. Very quickly, because then I need to go to the others.
There are some data pointing out that the minimum number of people having long-term COVID may be 5 to 10%. Now do the math.
5 to 10% of those who got COVID. Okay, so my math is not great, so I will probably pick up a calculator after the show and make the calculation. But what I do know is that according to the WHO, more than 200 million people have got COVID. Yes. So how many are suffering from long COVID? If it's 5 to 10% of that, it is a humongous figure. Let me go back to Dr. Chandra at this point. Dr. Chandra, now, again, talking about cardiac conditions, because these are amongst the commonest conditions that have been reported in a lot of people post-COVID. Now, if somebody had a pre-existing heart condition and then got infected with COVID, I think it almost goes without saying that a cardiologist like yourself would advise them to constantly monitor their health and undergo regular checkups and not take their health for granted. However, what if somebody who was seemingly absolutely fit got COVID and then happened to develop some kind of complications later without actually fully comprehending what they might be suffering from? Therefore, the question is, who needs a full body checkup after recovery from COVID? How do you know that, you need it?
Okay, very good questions. And first, let me answer about those people who already have a heart disease and they develop COVID. So in these patients, they must keep continuing their medications. They continue their medications because many times I have seen that people have stopped medications. Number one, because of the COVID has happened. Number two, because they took vaccination. Now, this is something very serious. I have seen serious complications because they stopped blood thinners because they wanted to have a vaccination. And that is the time when they develop the problem. So that is number one. Number two is that those patients who had heart disease and also had COVID must continue medicines, but they have a higher chance of a prolonged recovery. So they must not get flustered. They should know. They should learn to kind of gradually pace up and come on to normal life. So that is my advice, that it will take some time. Be patient. Maintain your lifestyle in a way that you just do not jump back to whatever you were doing earlier. Otherwise, it will put a strain on the body. And number three is that those people who were normal, seemingly normal, but developed COVID, so when they should suspect that they are going to have a heart problem, or is there any chance? So now the thing is, there is no need to do a routine checkup for everybody. They should, in case those people who have high blood pressure, who have diabetes, who have high cholesterol levels or strong family history, they should continue taking care of their blood pressure, their cholesterol, their sugar. That's very important. And then, of course, if they develop any unusual symptoms, like a central chest pain or an acidity which is not responding to usual methods of home care for 15-20 minutes, that is the time they should go to a nearby hospital, get their ECG checkup done, and get themselves examined for suspicion of any acute heart emergency.
Okay. Dr. Wali, let me come to you now. The point really is, at what point do we decide that we need to seek medical help? Because for a lot of people, some of these symptoms may be mild. For many others, they may be serious, and there may be situations where you don't even know that you have developed a certain condition. I've heard from a lot of doctors, for example, that even somebody who never had diabetes in their entire life experienced a sudden onset of diabetes post-COVID. And it is possible that some of those people are not even aware of it.
Exactly. Neha, your channel has done a lot of research today. I'm very impressed with the kind of presentation you are showing. As I told in the beginning, COVID is a poison. And the research has shown very recently that COVID involves every blood cells. It stains those blood cells with its spike protein. This spike protein becomes microscopically binds to our blood cells, and it can produce havoc. Nobody can differentiate between it. And since we are discussing this today, a very important point I'm going to tell at this point is that some people after vaccination are also having these kind of symptoms, and they attribute it to vaccination. No, actually it is a residual COVID which is manifesting strongly after manifestation, so they should not get disheartened or demotivated for the vaccination. This is number one point I want to make. Number two, as Dr. Praveen Chandra has very rightly said, disorders like high blood pressure, dyslipidemia, that is the increased cholesterol, and eye symptoms are most important. You can have a change in number. One can have high cholesterol despite taking medicines. One can have increased doses of high blood pressure medication. In my case, I was in ICU for 5 weeks, and now my blood pressure medication has suddenly gone up. And I was upset to the extent that why my heart rate and my ECG and my blood pressure is going haywire. I had to go do my angiography day before yesterday, and to find out everything is fine. It was okay, but my blood pressure dose has gone up. So we have to visit the doctor. One tagline I will give then, when you are not feeling normal, when you are not feeling like you were before COVID, please go to the doctor, and Medanta luckily has devised a full program where Dr. Praveen Chandra works that have a full set of program for those COVID patients to screen them. And I would request all the hospitals, good corporate hospitals and even government hospitals should devise a standard program for all COVID patients to screen them because patients would sometimes forget the symptoms. So all these patients who have suffered COVID, unluckily we had second wave. But I was telling at the end of first wave that they are going to head for post-COVID, long COVID or long haul. And we should have a program as your Dr. Paul has said. In America, they have apps, they have various devices.
In India, we have a lot of catching up to do, clearly. So I think that's good advice for hospitals. That is good advice for hospitals to have those tools, necessary tools in place for the kind of screening you need to subject a patient to. But, you know, when you say if you don't feel normal the way you did in your pre-COVID days, then you need to go see a doctor. To that, I would say, on a lighter note, I'm really not sure how many of us are feeling normal after having recovered from COVID, because it really seems to have changed our world. It seems to have changed our lives as we knew them. But I must say here also, Dr. Wali, sorry to hear that you had to spend 3 weeks in the ICU, but I certainly hope that you've recovered. I wish you great health. Okay, good to see you in
full recovery.
Okay.
Exercise that will make you to recover faster.
Start exercising. Though we also heard one of the other doctors saying, don't put undue pressure on your body. You also have to listen to your body at this point. But I take your point. You have to. Okay, you have to strike a balance there. And of course, I guess all of us really have to make that little bit of an extra effort to at least feel normal, as Dr. Wali puts it. Well, on that note, gentlemen, thank you so much for joining me on the show. It has certainly been quite an instructive experience talking to all of you about something that affects so many of us around the globe. And thanks very much to the viewers for watching.
You're watching